PSA, if you are about to get lipo, BBL, tummy tuck, any procedure that includes liposuction, listen to me and listen to me very clearly.
Waking up out of surgery was 10 out of 10 awful.
I did not expect that to hurt as bad as it did. Like, why did it hurt like that?
It was the worst thing I had ever tried.
I end up in the hospital for 5 days.
They start storing more fat in an area that wasn't sucked out.
My weight now goes straight to my hips and butt, and it's not in the way that you'd want it to be.
Truly regret getting liposuction. Like, truly, wholeheartedly, with my full chest, my soul, everything, I really regret ever moving forward with a liposuction procedure.
Okay, we need to actually talk about liposuction because I don't think people are being real about what this is. Everyone talks about it like it's a spa day. Go in, take a nap, wake up snatched, throw on a compression garment, sip some pineapple juice, done. New body. But when you actually sit down and listen to women who have been through it, it is so much more than that. Waking up in the worst pain of their life, fainting in the shower, leaking fluid, sleeping on their back for weeks because they physically cannot lie any other way. Blood thinner shots, compression garments for months, swollen to the point they do not recognize their own body. Some of them ending up back in the hospital. And I think social media has just completely flattened how serious this actually is. This is not a waist trainer. It is not a shortcut. It is surgery. And a lot of people are finding that out after they've already put the deposit down.
Getting the actual procedure done was so easy. Literally all you do is go, lay down, and wake up.
I did get lipo. I used to be like 35 pounds heavier than I am now. And I just like lost a bunch of weight after college because I wasn't drinking as much as I used to, and like my lifestyle changed. But I felt like even though I was losing all this weight, my arms were like just not budging. Okay, like I just was like, oh my god, my arms are too big for my body, which there's no such thing as arms that are too big for your body. Like it's not real. But it really like it got to me. Okay, and it was like my one insecurity. I was like, oh my god, I love my body, but why are my arms like my arms don't match my body? I'm gonna show you a pic. So this is a pic I took like right before I got it done. If you notice, like my arm versus my torso, like they're like the same circumference. And this is my new arm. It was honestly like the easiest process ever, and the recovery was like not that bad. I was in Hawaii for Tana's birthday, like literally 2 weeks later, swimming in the ocean, which is not recommended, but I was doing it. Please don't ask me how much it costs, because honestly, that fact will probably haunt me for the rest of my life. But other than that, I'm extremely happy with it.
This is my stomach, almost 3 months. Very linear. There's a lot of ups and downs. That is so normal, so expected, and it is so worth it. Like, I cannot emphasize that enough.
It's been about 3.5 months now since I got Lipo 360. I have to wear a compression garment though for a few weeks after. I think I wore mine every day for a month. That really helps get it smooth. Really my biggest fear when I was getting lipo is that I was gonna have lipo tummy. You know when people get lipo and it's like very lumpy and you can tell? Not me.
If I could go back in time, I probably would have never got a BBL, but this is what I would have got instead. Lipo 360, no BBL. And if you've been watching me for a while, you know I literally just got a round 2 BBL the other day. And that was just to correct my first round. But if I could go back in time, I would have probably never got a BBL in the first place. I would have just got lipo. And this is what you got to understand. When you get really good, aggressive lipo, it will give the illusion that you have a BBL. When you get that good Lipo 360, they take out the fat out your back, your stomach, your little fupa. It makes your ass sit up higher, makes your hips more pronounced, and your waist will be this small, which will give the illusion that your butt is bigger. This is not the option for everybody, and I get it. But if you've been contemplating between both, girl, get the lipo. HD lipo preferably. You just got to make sure you go to the right doctor, though, because not every doctor could give you that look.
I get why it is tempting, though. You have got a stubborn area, you have tried everything, and you were just like, why not just take it out? And when you are scrolling and seeing full body liposuction, arm liposuction, tummy tucks, Brazilian butt lifts, all these smaller, curvier before and afters, yeah, it is convincing. Of course it is. But nobody is posting the part where you wake up from anesthesia feeling like you got hit by a truck. Nobody is posting the bruising, the drains, the fluid leaking through your garment, the moments where your heart rate spikes and you are genuinely scared. That is the part that needs to be seen before anyone books a consult, not after.
Waking up out of surgery was 10 out of 10 awful. Like, I thought everyone was being dramatic, and they're not being dramatic. Waking up out of surgery, especially because I literally got everything, like lipo, fat transfer. It was terrible, and I was in so much pain. Luckily, the recovery house I stayed at was pretty close to the clinic that I got all my work done. I was really only in terrible pain for probably 20 minutes. 30 minutes max. And then once I got back to the recovery house, I took a nap and some pain meds, and I woke up and it literally never hurt again. But I was also taking my pain meds every 4 hours like they suggest. I did that probably for 3-4 days, and then I was pretty lax with it and never hurt. But waking up out of surgery was terrible. That being said, after the initial wake up, like, I was fine. I was able to put my own faja in. I showered myself after 2 days. But there are some people, like, I have a good pain tolerance. If you don't, the recovery house I stayed at, they like offer to help you shower, put on your faja, take it off. You can call them at 3 in the morning and be like, I have to go to the bathroom, and they can't get up themselves, so they will help you. So that I think was really a positive, but I was up and at 'em the week of surgery. I started to feel normal probably around 2.5 months. It is a long recovery process. And I felt good right away. Like, if you look at my videos, I stopped wearing a faja 24/7 around 3 weeks, but like your skin still feels weird. Like, you don't feel like you're in your body. But around 2.5, I'm at 3 months now, I'm starting to feel normal and swelling starting to go down. Like, I have a thigh gap again. Thank the Lord, because I paid for it. But your skin, I don't know how to explain it. Your skin doesn't feel like your skin. It feels like it's stuck on the inside. It's a strange feeling. But around 2-3 months is when I started to feel normal. And then for my surgery, I had to stay in Miami for 5 days post-op. And then that's when you're cleared to go travel. So those 5 days, I have an old roommate that lives in Miami now. So I flew in, stayed with her the first night, had my surgery, stayed at a recovery house 3 nights after my surgery. And then the last 2 nights that I had to stay there, I stayed with my old roommate. So that was really convenient for me. Overall, I would suggest a recovery house or something like that, just because it's nice not to think about anything. They like wake you up when it's time to eat. They help you go to the bathroom if you need it. They help you shower. They wash your faja. And you also are like leaking from everywhere. So if you were staying, like if I was staying at my girlfriend's house that whole time, like I would have bled all over her house and it would have been disgusting. It's a long and annoying process, the healing, but overall, it's worth it because
when I had that BBL, the pain that I had there, I was like, I would never, ever, 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 ever subject myself to that kind of pain ever again.
Y'all need to start telling people the that happens after you get liposuction. You can't sneeze. Getting liposuction was gonna be the death of me. I fainted 3 times because I wanted to go shower. You can't get the by yourself. I was sleeping on my back for a month. I couldn't lay on my stomach. You're gonna feel like you gained more weight. You're gonna look like you've gained more weight. Choked on some water, and when I tell you, I would have rather died. I'm still struggling. Every time I look in the mirror, I said, where is the new body? Because I don't see it anywhere in the room. Where is she?
Here is something that really stuck with me. So many women said the actual surgery was the easy part. You go in, you lie down, you wake up. Fast. It is the waking up that is brutal. One woman said she used to think people were being dramatic about liposuction recovery, and then she went through it and realized, nope, they were not exaggerating at all. Sore everywhere. Sneezing hurts. Coughing hurts. Choking on your own water hurts. Showering hurts. And there is this really strange emotional layer to it too, because you paid for this. You wanted a new body. And right now, all you are looking at is swelling and pain, thinking, okay, where is the new body I signed up for?
Here's some of the things I wish I knew before I had got my surgery. The pain. I did not expect that to hurt as bad as it did. Like, why did it hurt like that? Why was it hurting like that? Please, somebody let me know. Was y'all's hurting like that or not? I don't really think that y'all understand what I mean when I'm saying it's hurting. I'm not meaning it's hurting like regular people be hurting. That shit was hurting like I ain't never felt before. If I would have kind of prepared for it to be like that, maybe I would have knew I wasn't, nobody told me it was going to hurt like that. I knew it was going to hurt, but nobody warned me about the excruciating pain that I was going to be in. Another thing that I wish I knew was about like the faja stages. When I first got still confused on fajas and stages, if somebody would explain to me like stage 1, 2, 3, and 4, you wear this one from 0 to 6 weeks. You wear your stage 2 from 6 to 12 weeks. You wear your stage 3 from 12 to 24 weeks. You wear your stage 4, 24 weeks. Like I would have been it would have took a lot of stress off me from trying to figure out all these other things, Number 3, them people at that facility don't give a motherfucker about you. Them people at the facility is not going to be like you see it on Instagram and on these TikToks and videos. Sorry to tell you. Now, if you go somewhere really expensive and fancy, maybe. But if you're going to Miami, you taking your ass to one of them places, Vixen, Miami, Lipo, all these places, they are not like how they look on Instagram. They're not going to be all talking to you for 35 minutes. They're not going to be asking you all these questions and showing wish pics and all this extra stuff. At least mine wasn't. It was a quick in and out. I'm gonna show y'all how it went. It was a quick in and out. I wouldn't even call it a conversation. Honestly, I'm not even trying to be funny or talk about this man, but I really thought he was drunk. That's how he was acting. I don't know if he was overworked and tired because he done did multiple surgeries because they was getting them motherfuckers in and out quick as hell. I don't know, but I was concerned. I started second guessing if I should even get the surgery at that point because I kind of was thinking this motherfucker seemed like he's either on drugs or he's tired as hell. I don't know, but I still did it like a dummy. I'm telling y'all, I was in there. I'm thinking like, should I do this shit? Because this motherfucker don't seem like he in his right mind. I don't know. I feel like if the surgeons is doing more than 2 surgeries a day, you don't go to them because at this point they just doing shit. Or whatever number I'm on, I done forgot. When you fly out of town to get your surgery, they're gonna give you some type of shot you gotta take when you fly back, like before you fly back to prevent blood clots or something. Nobody told me about that motherfucking shot. Why didn't none of y'all say shit about that goddamn shot? And the thing is, they don't give it to you. You gotta give it to yourself. Do I look like a motherfucking doctor? Bitch.
So I had Lipo 360 8 days ago. And that is basically from the top of your body, trunk down to the top of your butt. I did not do any BBL. I didn't do anything like that. I did lipo all over my back. I did lipo in my arms. I did lipo on the side of my legs. And I was not at all prepared for how sore and how tender my body was going to feel. So now that I'm 8 days post-op and I would say, in a better place than last week, I just want people to know that you are going to be swollen beyond recognition in those places. You are going to weigh 5 or 6 pounds more than when you went into surgery because your body is going to be full of fluid and swelling. And you are going to feel like nothing can touch your skin. Even the binding that the doctors give you to put around your tummy tuck, if you do a tummy tuck with the lipo, it's going to be painful. Laying on a pillow is going to be painful. Sitting up is going to be painful. It's just everything you do is going to be painful. So something that I did is I took arnica, the tablets, and I've been rubbing arnica gel on the outsides of my legs, and that has helped with the bruising. But the tenderness and the soreness and the swelling is something that nowhere that I researched did anyone really talk about that. So I think it's really important for you to know what you're up against when you're going in for this surgery. Something that I think might make things easier for people is making sure that you have somebody there to support you, to help you up and help you down. Because trying to do it on your own, even though you can, it's just going to be so much harder and so much more painful. And making sure that you take the medication that the doctor prescribes to you while you're swollen and sore is really important too. Because if you try to tough it out like I've been doing, you might just end up emotionally broken. Because I was trying not to take the medication. I was trying to do less, like bare minimum. And it just was making me absolutely miserable.
Then there is the compression garment stage, which is its own whole thing. You are in a stage 1 garment, then a stage 2, trying to figure out sizing while your body is tender and swollen and changing shape week to week. Some women said they had no idea when to size down, how tight it should even feel, how to manage it all while also trying to shower, sleep, use the bathroom. If you do not have someone helping you through those first few days, it gets brutal fast. That is honestly why recovery houses exist, because some people genuinely cannot get up, shower, or take care of themselves alone right after. And that is a cost people forget to factor in. The surgery is not the only expense. The aftercare is basically part of the procedure.
Let's talk about the first time you take that compression garment off after your plastic surgery. So if you are having liposuction, you should be walking out of your surgeon's office with a compression garment, with a faja on. The danger starts the first time that you try to take it off, whether this is going to be for a shower or whatever reason you're taking it off. Just because you feel good walking around, just because you feel fine standing up and sitting down does not mean you're not in danger. The first time you're going to take that garment off, you are messing with the general blood pressure in your body as you are loosening the compression. You may feel dizzy, you may feel faint, you may actually almost faint or completely faint. So when you're taking that garment off, you're going to be doing it slowly. You're going to be doing it in a safe area. You're going to be doing it with somebody close by that can help you in case of emergency. What you don't want to do is say, oh, I want to take a shower. I don't want to have this garment off for too long, so I'm going to whip it off as fast as possible, jump in the shower, turn the hot water on hot as fast as possible, and then jump right out and try to put myself back in it. That is a recipe for disaster.
So I flew to Miami. My surgery date was March 27th. I went with Smart Plastic Surgery, and I had Dr. Shanklin. He's an awesome doctor. I have nothing bad to say about him. So I went there to get Lipo 360 and BBL. And I was nervous, of course, going in and stuff like that, because you just never know, like, what's going to happen after these surgeries. So I prayed, and I prayed. So luckily, I went out of surgery. Everything was well. But a day later, I was having complications. And when I say complications, it led me to be in a hospital. Like, it was real bad. So a day later, like, I was having a hard time breathing. I was short of breath. My heart rate was so high. And I'm like, how is that high? And I'm just sitting here resting. And it was at 140 resting. So I'm like, something's not right. Like, is this normal to have short of breath? Things like that. So I didn't want to take no chances. So I went straight to the hospital. So the ambulance came, I went to the hospital. So when I went to the hospital, they immediately wanted to do like a CAT scan on me to be sure that there were no blood flowing through the lungs and stuff like that, or any blood clots. So they did that, and the first thing I'm like, just had surgery. I don't possibly lay on my butt. And they said, well, this is an urgent scan. We have to do it. So I had to get the scan. Luckily, no blood or anything like that, no blood clots. So they gave me fluids, ran through the IV, blah, blah, blah. But as I was lying there, it went even higher. And when I say higher, like, it went to 175 just resting and sitting down. All the lights on the little thing or whatever, it was red. I was scared. I was crying. It took them a minute to come in the room. I'm like, what is you doing, like, on TikTok or whatever, blah, blah, blah. I don't know, but it took them a minute to come to the room. So I was scared. I instantly called my mother, because I'm like, well, I don't know, it's going to be my last, time breathing. I don't know. It was really scary for me. I was there. It was me, and then my friend, she was there as well. But my mom, kids, and other family was at home. So I FaceTimed her. I tried to FaceTime my friend. And it was real scary, But fast forward, they was able to get it down. They gave me meds to help with the heart rate. But then the next day, I was still having the same problem. And I'm like, what is going on? Like, I was asking a few of the other girls who had surgery with me. I'm like, are y'all having shortness of breath or anything like that? And they all said no. So I'm like, why am I the only one to have this problem? Like, what's going on with me? Like, I never had that type of problem. Like, what is going on with me? So I'm like real nervous. I got anxiety, all type of things. So the doctor really didn't give an explanation why. The tests came back okay. They did say that my iron level was low. My iron was at 7.7, which they said it's supposed to at least be at 11.5. So that kind of scared me. But I noticed that I did lose a lot of blood, and I'm thinking like, why didn't they do a blood fusion on me? So I don't know, but it was a really scary experience. And then when I went back to Atlanta, I stayed in Miami for a week, and then I went to Atlanta April 1st, where I live at. And when I got back to Atlanta, I was still having complications. So I went back to the hospital, and they repeated the test again to be sure no blood got through the lungs or anything like that. So it's been real rough for me, real rough. I am a little nervous. I'm still nervous because, like I said, with these surgeries, you just never know. People get blood clots, all type of things like that. And it's really scary. I have 3 kids.
The safety piece of this is not small. Shortness of breath, elevated heart rate, low blood levels, fear of clots, hospital visits. And yeah, there are tragic stories where people did not make it through or recover from this. This is surgery. Anesthesia, blood loss, fluid shifts, infection risk, all of it. And on top of that, you have to actually verify who is doing your procedure. There is a real difference between a board-certified plastic surgeon and someone who calls themselves a cosmetic surgeon with a fraction of the training. Most people do not know to ask about that. They see the results, the payment plan, the viral doctor, and that is it. But this is your actual life we are talking about, not just an aesthetic decision.
So there's a tragic story of a 28-year-old woman who died while having liposuction. She was a mother. And in and of itself, that's incredibly tragic to go in for an elective surgery, something as simple as liposuction, and die. But what makes the situation incredibly egregious is the doctor was a pediatrician. There is a huge misunderstanding, and continues to be despite all the information that's out there, between plastic surgeons and cosmetic surgeons. So a plastic surgeon is someone who goes to plastic surgery residency. A cosmetic surgeon is someone that goes to any residency, OBGYN, internal medicine, emergency room physician, orthopedics, and then goes and gets cosmetic training from a weekend course to 1 year to whatever, and then goes and practices that cosmetic surgery, as in the case of this pediatrician. Who's regulating this? No one. When you're in your own private practice, in my surgery center, I am the medical director. Therefore, I determine who does what in my own facility. So in and across this country, cosmetic surgeons of God knows what type of training are doing thousands and thousands of procedures to patients unbeknownst to them. The onus falls on you. You need to do your homework.
Healthy and vibrant law graduate 25 dies on an operating table during liposuction op. Why do people die during liposuction? Look, I see people talking on TikTok, talking about liposuction as if they're just going for a haircut or they're getting their nails done. It is a dangerous procedure because you can get something called a fat embolus, which will kill you. What that means is, as they're disrupting all the fat here, there's lots of veins mixed in with the fat. All it takes is for a tiny piece of the fat to get into the vein, to go up into your circulation, block a blood vessel further up the track, so somewhere like in your heart or your lungs or your brain. If this happens from something like a DVT, which is a blood clot, we can give you medication which destroys that blood clot and dissolves it. We can't give you anything to dissolve a bit of fat. If it goes into your heart and your coronary artery, there's not really much you can do about it.
So last year I got a fleur-de-lis tummy tuck, which was okay, minus the giant scar on my stomach. And I got liposuction about 2 or 3 months later for no reason. And let me tell you why. The internet and TV will tell you that liposuction will solve all your problems and you'll wake up from surgery like 50 pounds lighter and looking like a brand new person. That is not the case. And I would have known that if I actually researched it at all. They can legally take out about 5 liters, which equates to 11 pounds. And you can do a lot to lose 11 pounds in a much shorter amount of time than it takes to recover from liposuction. So unless you're getting a very specific area done, I got my back and my thighs done. And now my back and my thighs are covered in scars from where the cannula went in. And I also occasionally still feel a random burning sensation from where they went in on my hips. The fleur-de-lis, again, was okay. But I would highly recommend you do not get general area liposuction. Go get yourself a nice pair of knockers instead and keep it moving. Just don't waste your money.
4 reasons I will never have liposuction ever. Reason number 1, the drains. They are horrible. Now you get the drains with the boob job and with the tummy tuck as well as the liposuction. So I had 5 drains in total. Out of all the drains I had, the one in my back for the liposuction was by far the worst. It was the most painful. It had the most fluid and it just was horrendous. There was minimal fluid out of my boobs, there was minimal fluid out of my tummy, but the back one from the liposuction was just insane. I had to have it in the longest. It was the most disgusting. It was the most painful and uncomfortable. And I just would never ever choose to go through that again. Reason number 2, the bruising and swelling. So I expected a lot of bruising. I expected a lot of swelling from the tummy tuck. I did not expect that 4 weeks later, when all the bruising from my tummy tuck was gone, most of the pain from my tummy tuck was gone, that I would still barely be able to touch my back because of how tender I am from the liposuction. It is crazy. It is by far the most painful bruising out of the whole lot. My boobs, there's no pain in them at all anymore. There's minimal pain in my stomach and the swelling's really dying down, but my back is still so swollen and still so tender to the touch. Reason number 3 is the itchiness. Your whole body is itchy. From the second you can start feeling it again, you are constantly itchy everywhere. So the whole way across here, right up my sides and right up my back right now is just painfully itchy. All I want to do is scratch and scratch and scratch, and I've been told that that's completely normal, and I know it's completely normal, but it is absolutely infuriating. You don't get a second's rest from it. It is starting to die down now, but I have been nothing but insanely itchy for almost 4 weeks now. And number 4 is the results that you get. I feel like I got the majority of my results from the boob lift and the tummy tuck, and whilst I do think the liposuction had an effect for how painful it is, how long the recovery is, and how infuriating the recovery is, I just don't think it's worth it. If I had the choice to go through it again, I think I would get the tummy tuck without the liposuction.
The drains and the leaking. I was not ready for how much this came up. Fluid, blood, drains hanging off your body, trying not to bleed on someone's furniture. That is the part Instagram completely skips over because online it is all snatched waist, new body loading. In reality, some women said the drains were actually the worst part of the whole thing. Not the incisions, not even the tummy tuck itself. The drains, because they are uncomfortable, they are in the way, you are scared to bump them, you are trying to shower around them, sleep around them. It is a lot, mentally, and nobody prepares you for that specific kind of exhausting.
Things I wish somebody would have told me before I got my tummy tuck and liposuction. Your results are not going to come out the exact way you expected. It takes weeks to months before you're able to sleep on your side or your stomach. You have to sleep on your back with your knees propped. Also, the skin tightness in the front, even though you're able to sleep on your stomach or your side later, you're not able to fully arch your back. So if you're the type of person who likes to arch your back when you're not going to be able to do it the way you did before. The complications that we may deal with could create a scar line that's way more visible than you expected. Also, the appearance of the belly button. Sometimes the belly buttons look really bad. You don't want that, but it happens. The pain. Obviously, we know that it's painful, but how painful will depend on every person. I wasn't expecting the liposuction to hurt worse than the actual tummy tuck. If you have loose skin on your hips, or you plan to get liposuction to your hips to remove love handles, you're going to have loose skin there. When they do a tummy tuck, the incision can only go so far before it becomes like a 360 lift. So the sides will have loose skin. In some cases, not all, you'll end up with something called dog ears. And that's basically where the hips are pulled tight, the stomach is pulled tight, and the skin that's left in the middle where the love handles were at is loose. So it looks like flapping dog ears. I ended up with minimal dog ears, and I have a procedure coming up to have them removed. I wasn't expecting that. During the tummy tuck, they cut through all of that skin and nerves. I still don't have feeling in the bottom of my stomach, and it's been almost a year. Also, when you're healing from that procedure, the nerve endings are trying to reconnect themselves, so you'll experience a ton of shocking, tingling, prickles, really weird feelings. And also in the liposuction, you'll have a lot of heat and weird sensations going on in there too. One of the most common things you'll hear when somebody's getting any sort of procedure is that once you have liposuction or a tummy tuck, there's no more fat cells in those areas for fat to go to. So if that's where you stored most of your fat before, your body's going to find another place to store the fat. Even worse, because I had liposuction to the flanks, there's no more weight that will go there. So if I gain weight in my butt or my back, it makes the butt and the back bulge, and it looks like I have dents in the liposuction spots. My weight now goes straight to my hips and butt, and it's not in the way that you'd want it to be. Also, with aging, the skin's going to sag in certain areas where it doesn't where you had your procedures done. It makes a very strange look in some cases.
The drains. The drains were like such a big deal for me. For some reason, like I feel like they're the worst part. They're in the way. They are so, you see this thing around my neck. The drains are connected like to like basically my vagina, like right up top. And they just come out and they just fill up with stuff, and it's just a dramatic thing. Because they're in a weird placement, it's just kind of painful and it's hard to wear underwear. I honestly suggest just not wearing underwear during this recovery. And you're just constantly have to make sure that you don't like pull one or pull it out. And then all that good stuff. I definitely suggest a lanyard. My doctor gave me this and they just like clip onto it. I do know that some doctors don't, so if you don't have a lanyard, get it, because it's so much better to have it like hanging right here than having to constantly either hold them or like stuff them in like a pocket or something. Okay, next one, your lower back is going to kill you because like you have to stay bent over for so long. It hurts so bad, and plus I also had lipo back there, and so it's just the like strain of having all of that weight like just bearing on my lower back at all times. When walking, I'm still walking kind of bent over, so get ready for that because it hurts really bad. I get asked this a lot, but the most painful part of the entire thing is lipo. It literally feels like, this is brutal, but you were like beaten like with a baseball bat. Like your entire body hurts. You're swollen everywhere. You're bruised everywhere. Like my hips were so swollen. I didn't even get lipo on my hips, but just like up top, on the sides, and on my back. But oh my God, it is still painful. Like don't let anyone touch you because it's so painful. Take your stool softeners. It's also at first can be very hard to wipe your booty, so be prepared to have someone do that or be creative. Also, the blood thinner shots that you have to take hurt. I did mine in the back of my arm. Well, like my husband did it, so whoever takes care of you will give you the shots. They're painful.
Nobody really explains the swelling part properly either. A lot of women go in expecting to wake up smaller. Instead, your body can swell so much you actually look bigger. You might weigh more from fluid retention. Your skin feels tight, puffy, weird to the touch. Imagine getting surgery specifically to feel smaller, then looking in the mirror a week later and feeling like you look worse than before you started. That is why the timeline matters so much. This is not an instant result. Some women said they did not feel normal again until 2 or 3 months out. That is not a weekend recovery. That is a long, uncomfortable stretch where you just have to trust the process and wait.
It's deeply problematic for metabolic health, and that's because, as a reminder, it's not the mass of fat we have that matters most when it comes to metabolic health. It's the size of our fat cells. So let's imagine an individual who has more fat than they want in some particular part of the body. The best way to help reduce that fat is to shrink your fat cells. So that's very important for people to realize. When you lose weight, you're not killing fat cells. You're not getting rid of them. You're shrinking them. And small fat cells are very anti-inflammatory. They're releasing hormones that fight inflammation in the body, and they're very insulin sensitive, which helps the body, by extension, be very insulin sensitive. So very healthy. Small fat cells are healthy fat cells. The problem with liposuction is that you are going in and rather than shrinking the fat cells, you are sucking them out. Now, let's say like a study that was done in the US in women. They found that when women had liposuction from their buttocks and hips area, which is where most women gain their weight, which is because of sex hormones telling her body to store that weight there, they may look at that fat on their buttocks and hips and say, there's more than I want, I'm going to suck it out. So they do, but they don't change their habits. So they're still eating the same way they were before. Essentially, now they have fewer fat cells, but the body wants to store that same amount of fat based on how they're eating. In other words, there's enough insulin telling the body to store a certain amount of fat, and there's enough calories to fuel that fat storage. But the fat would be saying, hey, we don't have all these fat cells in the buttocks and hips like we used to. Let's go somewhere else. And so it's no surprise that over the ensuing years after she's had liposuction, not only does she not experience any improvement in any health marker, nothing gets better with regards to her health. And that is, again, reflective of the fact that it's the size of the fat cell that matters. Maybe she has lost 10 kilos of fat. That might be a little much for liposuction. 6 kilos. And you would say, well, you have 6 kilos of less fat. Clearly you're healthier. And yet they're not at all. Nothing has gotten better. And then if you follow them over the years, they cannot gain that fat back on their buttocks and hips because it was literally sucked out. And adults have a hard time making new fat cells. So it's no surprise that they start storing more fat in an area that wasn't sucked out, namely their belly. And so a woman who's gone through liposuction, yes, she will have lost fat by liposuction at her buttocks and hips, but if she doesn't change her lifestyle habits, the body will take the 6 kilos and say, well, I need to store those now somewhere else because you're eating in a way that makes me want to store that much fat. And so her remaining fat cells that are intact get bigger and store a bigger burden. And so over time, it's no surprise that health outcomes can start to get worse. By having fewer fat cells, she's increasing the burden that the remaining fat cells have to carry. Not only does that result in a change in where she's storing fat, namely storing more on her abdomen, but all the fat cells will get bigger, and thus metabolic health can get worse.
Here is something people really underestimate. Liposuction can change where your body gains weight later. People assume once that fat is gone, it is just gone forever. And sure, fat cells in that specific area might be removed. But if your lifestyle does not change and you gain weight down the line, your body just finds somewhere else to put it. Multiple women talked about this exact thing, weight showing up in their hips, their back, areas they were not expecting, and the treated area ending up looking dented or uneven by comparison. One woman flat out said she regrets it because her body just feels harder to understand and harder to tone now. Because liposuction does not touch your eating habits, your relationship with food, your workout routine, or your body image. If the habits that got you there have not changed, your body is still going to change, just unpredictably now.
The one thing about liposuction that you need to know, because I did the liposuction around here, if you don't eat well, you don't exercise, and you gain weight, you can gain weight in other places. Like, for example, like, I'm not as like snatched as I used to be right after the lipo because I had like none of this. Like, this did not exist when I had it. It was like very tight. That's because like over time we're just gonna, you know, start eating like bread and rice, and you know, those are things I love to eat. Like, I'm Asian, I love noodles, I love carbs. Like, so over time you'll start to slowly, like, it'll slowly creep in. And the thing about lipo that I realized, and it is true, like what people say, when you do gain weight after liposuction, it goes elsewhere. So I notice, like, if I'm not really good with my diet, I'm not working out as much, I'll notice that it's actually going to my hips, which is like, I used to never ever gain weight on my hips. I had like tiny little hips. I'm not tiny, but like it was very, you know, small compared to what it is now. So I definitely have a little bit of a butt, which I feel like a lot of my Asian friends are like, oh my gosh, I want a butt. Because we, you know, a lot of Asians tend to have like flatter tushies, and we want a little more like of that voluminous, like, you know, voluptuous look. But that's what I noticed. Like the weight will, instead of going into like my love handles or in my tummy area, it will go to my hands. So be careful with the lipo. Like, you don't want to do the lipo and gain a ton of weight. That is like bad, because I don't know where the other fat will be distributed to.
I've done the 360 lipo, but I'm not happy. Now, where they did suck out the fat and I'm going to the gym and I'm losing weight, I've seen a difference, a huge difference. But in the place that they didn't suck out the fat, I hate it, okay? I've been trying so hard to lose the weight and tone up that area, but it just isn't working. Now, I am going to focus on my diet and see if by summer I see a huge difference in my back. If not, I am going to do like non-surgical treatments and see if I can just get rid of the fat in that area. Now, I am going to show you, this is very vulnerable for me, but let me just share it and let's see. Let me track my progress with you and yeah, just share the experience. Because yeah, this is something I've been battling for the past year and a bit, maybe like 2 years. So you see this area here? Hate it. But I am going to insert a clip of what my back did look like and see, can you see a difference? Because as I'm losing weight, it's so weird to think I've lost weight everywhere else, but how is that side still the same size? I can't really see a difference there, and it's pissing me off.
A real Lipo 360 means the doctor's going to have to put in the work, starting with you face down, lipoing that upper back all the way to the spine, that mid-back bra line all the way to the spine, the flanks all the way to the spine, that upper hip bulge, even the sacrum. Then we're going to turn you over, lipo that annoying little bra bulge here, little axillary area, that lateral bra line bulge, upper abdomen, all the way to the xiphoid, lower abdomen, and the pubic area, and then do your tummy tuck. You see, if they were doing a Lipo 360, they would say it. It takes a lot of work, and most don't want to do it. But it means all the difference in the world between this and this. And let me tell you, regular tummy tucks, they don't give you curves. Even when tightening the muscles, barely makes a difference.
Truly regret getting liposuction. Like, truly, wholeheartedly, with my full chest, my soul, everything, I really regret ever moving forward with a liposuction procedure. I have been debating on making this video for like the longest fucking time ever. And I'm not saying this lightly. I have been struggling the last 2.5 years making peace with the fact that I did this procedure. I feel like it is absolutely impossible for me to lose body fat, to tone up without having constant body dysmorphia, without constant like mental struggles. And then like, not just that, at one point, I swear to God, I thought I had fibrosis. Luckily I didn't, I had that checked out, but now like where I had the liposuction, so I specifically had the mommy pouch area done. So although it's not fibrosis, the area above where I did have the liposuction, there's like lumps. I don't know if it's like fatty lumps. I don't know what the hell it is. It's just, every time I look in the mirror, it truly, 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 truly upsets me. Like, I honestly just want to break down and fucking cry every time I look in the mirror. Every time.
I also think people need to be honest about the stubborn fat narrative, because sometimes it is genuinely stubborn fat, and sometimes it is something else entirely. Sometimes it is comparison. Sometimes it is a trend. Sometimes it is just fixating on one part of your body until it feels like the reason everything is wrong.
Biggest regret I have in my life is that I chose to get liposuction on my inner thighs to conform to that beach girl body. I was about 23 or 24. If I had my time again, there's no way I'd go through with that because my body was still forming. So I had to change the way that I ate, and then I had to change my relationship with myself. I was really unforgiving. I was really self-critical. I was judgmental. And if you don't know what kind of relationship you have with yourself, have a look at the relationships of the people around you that you have with them. The people around us tend to be a reflection of who we are. So I had some people around me who also had body image issues and were attempting to find their way and conform to what we thought the industry and the surf world expected of us.
One woman got arm liposuction because her arms did not match the rest of her body. Another did inner thighs, chasing a specific look. Another regretted her stomach area because it actually made her more distressed afterward, not less. And that is the deeper issue. If you already struggle with how you see your body, surgery does not automatically fix that. Sometimes it just sharpens your focus onto the next flaw. You fix the stomach, then the arms bother you. Fix the arms, now it is the back. That is how this becomes a cycle instead of a solution. To be fair here, plenty of women are genuinely happy with their results. They say it was worth every bit of the recovery. Their confidence went up. They would do it again in a heartbeat. That is real, and I do not want to erase that. But the positive stuff is what gets pushed the loudest during the marketing phase, while the complications and regret tend to surface way later, months, sometimes years out. So do not just watch the reveal videos. Watch the recovery. Watch the regret stories. Watch the 2 years later updates. Watch the people who gained weight after and are dealing with a totally different body shape now. Because the real question is not, do I want the snatched body? It is, am I actually prepared for everything it takes to get there? So this is not me saying liposuction is inherently bad. It is that it is not the simple, harmless thing social media makes it look like. It can be painful, expensive. It can mean drains, compression garments, swelling, numbness, months of healing. It can leave scars, lumps, uneven results. It can change where your body holds weight going forward, and it does not fix your relationship with your own body. If you did not love it before surgery, that feeling does not automatically disappear after. So before booking anything, actually research your surgeon. Understand the difference between plastic surgeon and cosmetic surgeon. Ask about clot prevention, ask about drains, ask what happens if you gain weight down the line. And be honest with yourself about whether this is something you actually want or something you are reacting to because everyone around you is doing it. Because this is not a filter. It is your body going through real trauma for a result you are hoping you will love. So, is liposuction worth the risk to you, or do you think people are treating a real surgery way too casually?